Hi everybody, Dr. Kerry Yerkew here. Today I'm going to go over 7 good stretches for Piriformis Muscle Syndrome. And the piriformis muscle is a smaller muscle that's in the hip region, in the buttock area, and it can put pressure on the sciatic nerve, cause sciatica. So we want to talk about how we can stretch out that muscle in conjunction with chiropractic care to rebalance the hips and restore the proper tone and balance of the muscles as well. So I found this article from the Cleveland Clinic, and I'll put a link in the show notes below, but they did a very good article on exercises you can do for piriformis syndrome. And first, you should see your healthcare professional to get this checked and diagnosed properly. If you're a patient of mine and I'm sending this to you, it's because there is piriformis syndrome, and I want you to be able to do some exercises at home to help it. So the knee to shoulder piriformis stretch is really good, where you bring the knee up to the shoulder. You can even go up to the opposite shoulder. Just hold that for about 10 to 15 seconds to start, and then you can gradually work your way up to 30 seconds. I would do this 3 times on either side, and then do it twice a day, first thing in the morning, just before bed. So all these exercises are the same as far as frequency and the duration for them. So ankle over the knee, piriformis stretch. This is like a figure 4, where you put your ankle over your knee, and then you let it stretch over, and it allows you to stretch out that piriformis muscle in the hip region. And again, starting with 10 to 15 seconds, and then doing that about 3 times, first thing in the morning and just before bed. Ankle over the knee seated. You can do this same stretch sitting in a chair, just letting your hip turn, your ankle resting on the opposite leg, and then your knee going down to the floor. That's a very good stretch. Do both sides. The bridge is when you have your shoulders on the ground or a table, and then lifting the hips off the ground and keeping this neutral position right here, this flat position. Side leg lifts. This one's really good. Just lie on your side, lift one leg up, hold, and let that go back down. Do the opposite leg as well. You can always use bands between the legs as well, and I'm going to show you a band exercise next called the clamshell right here, where you put a band between your knees like that, and then have some resistance opening the legs and closing, so the knees spread apart and then come back together again. Face down leg raises is good. Both legs on the ground, lift one leg up, hold for a few seconds, put that back down, and then repeat for 10 times each side. I would work yourself up to being able to do more repetitions and holding for longer periods of time, but always do it first thing in the morning and just before bed. And then you could do a squat like this. Sometimes I tell my patients to have a chair behind them just in case they lose their balance, but you want to stand, squat down, stand up, and then go back into a squat. That's a really good exercise to do as well. I'll put a link in the show notes for this article, and then you can click on those videos to be able to watch them to see more about how to do these exercises. If you're a patient of mine, feel free to ask questions when you come into the clinic. If you're not a patient of mine, we are accepting new patients in Kelowna. You can contact the clinic in the link below in the show notes, or call our number. If you're not in the Kelowna area, I'd be happy to refer you to a chiropractor in your area that does this type of work. And the last thing is, like this video and subscribe to our channel, because our channel's growing. We want to get to 500 subscribers, and that'll take our channel to the next level. So thank you very much for watching this video, and I'll talk to you soon.